After a year of work and missed deadlines, the White House expects this is the pivotal week for health care reform.
We do believe that a week from today, we'll be talking about a bill that has passed the House.
Convinced House Democrats will finally finish the job, President Obama pushed back his Asia trip to next Sunday so he can sign the historic legislation. But party leaders worry the 216 votes needed aren't there yet.
No, we don't have them as of this morning, but we've been working this thing all weekend. We'll be working it going into the week. I'm also very confident that we'll get this done.
But there are more challenges. The House has to pass two bills. First, the bill the Senate passed in December, then a second bill that makes changes to the first one. Those changes are necessary to bring enough Democrats on board. The Senate would vote on that second bill through a process called reconciliation, which requires only a simple majority. Republicans who used reconciliation when they were in charge are now crying foul.
I'm doing everything I can to prevent this bill from becoming law, plain and simple.
The GOP has been unwavering in opposition to the plan, calling it a government takeover of health care. They argue it will raise premiums and taxes.
This is the most brazen act of political arrogance that I can remember since the Watergate years.
But the real obstacle for Democrats, themselves. They've been at odds over the bill's abortion language and taxes on so-called Cadillac plans. Leaders hope they've finally made enough compromises to keep their coalition together. If it passes, the bill would require most Americans to be insured. It would expand coverage to 31 million people and put an end to some insurance industry practices like denying coverage based on pre-existing conditions. Russ?
Whit Johnson on Capitol Hill. Thank you very much.